As we should.
I think a lot of people right now too are scared about jobs, or especially biology jobs. It's nice that there is such a wide availability for histotechs. I was doing a job search last week, trying to put together a heat map. And there's like 78 open histology jobs right now across the state, which I know a lot of people like have rolling hires because like talent's low, but I was like,
Cotton Center, I bet you a lot of them are right there.
yeah, the clip path and then
Between Cliff Paris, Lockport, like all of them.
so.
Like,
And then I think even like a lot of the hospitals that are moved around in-house people. So. Awesome, and then when we get to you guys, I have to like out the premium. So. Perfect. Awesome. Thank you everyone for coming. To do a quick mic check for the online portion. Online people, can you hear us okay? You can just drop something in the chat, please. We got messages. Awesome. Thank you guys, I appreciate it. Go ahead and get started. See quite a few people I know. Thank you all for coming. So today we're going to be kind of doing like an info session / panel about careers in clinical lab sciences. These are really those like the professions that help generate the diagnostics data that guides all the medical decisions that physicians use. Yeah, these careers are often underlooked, especially by like career advisors inside of universities. On the pre-health track, I know a lot of us get pushed towards like be medical assistant or like go towards med school. But some of these other underexplored careers pay very well, which will send out a kind of like a diagnostics guidebook looking at like an overview of the careers, as well as they have like long-term like stability in their employment, and there's a lot of potential for growth out of those positions. So excited to explore that with you guys. This panel is designed to introduce you students to real actionable career paths in the clinical lab sciences. You'll hear directly from ASCP-certified professionals. All three of these individuals have worked inside the field for a very long time. They've got their like kind of like the ASCP is a certification board for the clinical lab sciences. All three of them have gone through the process of getting themselves certified, as well as guiding other people through that certification process. And then so I kind of let themselves go around and introduce themselves, like what they do today, what ASCP certification they have. And then today we're going to look at like what they do day to day inside of their work, what ASCP certification pathways look like, the job opportunities available in Arizona, kind of beyond, as well as some common like research skills that we learned here in university that would translate into these positions. So this event will include a moderated discussion, which is just going to be me asking them questions, and then we will have an open Q&A to the audience. And then afterwards, we'll have a small informal networking session. You can ask questions directly to our panelists today. And then if you are so it should be, I'm excited for it. Awesome. If you guys want to go ahead and introduce yourselves and like your ACP certification track, it'd be wonderful.
Hi everyone, my name is Mariana Romero. I'm currently a histology supervisor for LabCorp. I have my HT ASP certification for histotechnician. I'm also QIC qualified in the qualification for immunohistochemistry. I've been in histo not that long, actually. I don't think probably 14 years now. And I've done a little bit of everything in terms of there's different settings for histology. So I work for physician-owned labs, smaller practices, hospitals. I worked at Caris, which is a molecular profiling company, and it's mostly oncology. And I'm back at a reference lab currently where we process a lot of samples for clinical testing. So that's kind of a little bit of my background.
Thank you. My name is Steven Springer. I am triple boarded by ASCP. I started my career as a medical laboratory scientist, and then I got my master's degree as a pathologist assistant. So I have a PA certification, and then while I was working, got the molecular biology ASCP certification. Been in the industry now for about 18 years. I'm currently vice president of operations at Caris Lab Sciences. Started out my career at University of Iowa Hospitals and Clinic. I worked as a chemistry supervisor there in the hospital, just as kind of the medical laboratory scientist generalist, kind of some of the core lab functionality. And then from there, I worked at private practice. I owned my own business as an autopsy company, where we operated nationally and serviced a lot of law firms that you might have seen on TV for like mesothelioma and those types of things. And then from there, I worked at Kaiser Permanente in Northern California, oversaw anatomic pathology and molecular before I ended up at a couple biotech companies, CareDx, Foundation Medicine, and now I'm here at Caris in Phoenix, Arizona.
Thank you. I'm Yvonne Veloso. So I started as a pre-nursing and then decided not to go to that completely. So I did 2 years and then found out that there was a medical laboratory field and that sounded better to me. So I went to that program for 4 years, graduated with a medical laboratory science, took the boards within a month of graduating, and I was already hired before I passed the boards. And that was because I did clinical right where the school was, and it was in Virginia. And we were going through the different clinical laboratory departments through that teaching hospital. And then they just hired me. So that was because I just said yes to everything that they wanted me to do. And then after about 10 years, I found out that there was a histology and cytology. So I did histology, and while doing that, I found out that there was a cytology program with Quest Diagnostic in Las Vegas. So I went through that, and the hospital I was working for paid for my schooling. And then right after I finished that, I got certified. And then I moved here, worked at Caris for about 7 years, doing immunohistochemistry, a little grossing, histology. I did quite a few projects to bring up quite a few different tests in the lab and instrument validations. And then after that, I took like a year break, and then went to LabCorp as a cytotechnologist, where I had already taken the classes and graduated and was board certified. So I also have a QIC along with the 2 certifications. That's me.
I'm gonna hold up that.
Okay.
I got my mic right here. Thank you guys so much for introducing yourselves. We already talked a little bit about like what your ACP certifications are, but I think to a lot of students, it's a lot of acronyms, and we don't really necessarily know what's happening in terms of the responsibility of those roles. What types of testing or services fall into your scope of practice with your current license?
So for me, I'm currently at LabCorp. I'm a cytotechnologist. So I read pap smears, so GYN laboratory, and I also do non-GYN, which are the other body fluids. So if you go get a mammogram and they find maybe a cyst or a tumor growth, then they'll take a sample of that. They'll send it to the lab and process it for non-GYN, and that's what I look into, and before it goes to a pathologist. So, and the same with pap smears. There's like 3 different kinds right now, and so we have to get certified and go through testing and pass that before we can actually read the slides. And we have to get tested every year and pass that through ASCP, or no, through CAP, which is College of American Pathologists, sorry, I forgot. And so that's my current job right now, and then I work part-time as a histotech in a small lab. Actually, they're getting bigger. Western Pathology, I don't know if you guys heard of that. Yeah, and they do immunohistochemistry, they do fish, flow cytometry, of course, the histology staining and stuff like that. And I'm not a histotech certified, but because I'm MLS with QIC, I can do all of that. Okay. So.
Yeah, and since I'm in administration now, I can talk a little bit to the just certifications kind of leading up to where I'm at now. But you know, the medical laboratory science degree, I'll kind of start out, you know, ASCP as a whole is kind of like an industry standard certification. And it varies by state if you need an additional license on top of that, but it's often a prerequisite to getting that state license. For instance, you know, state of California, they want you to have the ASCP certification prior to you getting a state license. And you know, the MLS or they call it clinical laboratory science in California allows you to kind of work in any area of the laboratory. And then there's some specialty license like, you know, a histotech, you know, phlebotomy, even they'll have those specialty tracks. Molecular biology is kind of a separate one. So the medical laboratory science, generally a lot of people work in the hospital or reference lab environment in there, and we call it kind of core lab functionality. So chemistry, hematology, urinalysis, coagulation, blood banking are the big ones there. So when you have your blood drawn for like an electrolyte panel or your CBC, H&H, that's kind of what's done in some of those functions there, really the clinical lab. My other certification as a pathologist assistant, this is generally a graduate degree, 2-year program. There's just a few programs, one here in Phoenix now, the University of Jamestown just opened in the Cotton Center campus. They're going to be offering a PA degree. But this is more focused on anatomic pathology. So, you know, the major thing that people go in there is surgical pathology, where you're really focused on the macroscopic dissection of any tissue that comes out of surgery. So what you're doing as a PA is you're identifying, looking at that tissue, identifying anatomical landmarks, looking at the margins, putting some ink on the margins, and you're taking sections that are placed in cassettes. And those cassettes go to a histotech to embed, and that is when a slide is made out of that. And those sections that you take are representative of some tumor staging, and then the pathologist generally reads those slides so they can make a diagnosis and a staging of the cancer from there. Molecular biology is really focused in kind of the new biotech industry, as well as just molecular activities, you know, PCR, next generation sequencing, that kind of thing. It's a specialty track within California that you can get a license through, or a specialty within ASCP. It's really still up and coming. We're kind of in its infancy and it's starting to grow. I always compare it to kind of Silicon Valley in the 90s. With the tech boom, it's kind of, that's what's happening right now in genomics in that space. So that's a little bit.
You guys said a lot. From the histo perspective, in terms of ASCP, there's 2 different certifications that you can get. There's the histotechnician and histotechnologist, so HT, HTL. The difference between the 2 of them is how much education you need. Generally for the HT, you need an associate's degree and meet some certain, you know, biology and chemistry requirement, and you can go that way. For the HTL, you need a bachelor's degree essentially, and then science courses along the line of that. There's histology programs. We're very lucky here at Phoenix. We have one that's local through Phoenix College. That's the one that I did forever ago. And I got my associate's degree in histology that way. It kind of prepares you for clinical histo. And I'm in leadership now, so it's a little bit different. I manage a lot of people. I make sure the tests are getting done correctly, validations, making sure everything that we're bringing for the patients are validated and accurate. when we're running the test. But from a histotech perspective, you do a whole lot. Like he was mentioning, PAs do very complex grossing of tissue that's removed during surgery. Histotechs can also get trained in grossing, just non-complex samples. We're talking about little shave biopsies that you get when you go to the derm. You leave, we're in Arizona, you probably will get that done eventually, if you stay here. GI, colonoscopies, endoscopies, those little small samples, as a histotech, you can get qualified and trained to process those through grossing. And then you translate that tissue into a very thin slide for the doctors to assess at a, tissue cell level, I guess. But there's so much more that you can do with histo. You can get into research. You can get into oncology. That's what CARES is doing with molecular profiling. They do the molecular aspect of it, but their reporting is also comes with IHC, which is immunohistochemistry staining, which is a part of histology essentially. And there's a lot of stains that are FDA approved because they're predictive to conditions, and they can pretty much tell the patient, yes, this will be a great treatment for you. You'll be very responsive to that treatment. So overall, there's a lot of science involved in our day-to-days. But most importantly, the impact that we have with patients. Like I know Aiden made a really great point. When you're in school, you want to be a doctor, you want to be a PA, and there's a lot more out there that you can do. I went to school here at ASU, business school though, not science related, after histo, because I knew I wanted to be in leadership, and there's another path that you can take. Look, you have leaders here. You can make it whatever you want. But in my opinion, I feel like it's a very neglected field. No one really graduates high school and says, oh, I want to be a histotech. That was not my case. I was going to school for biotech. Someone came in, started talking about their research, and I was like, what is that you're doing? She was a histotech and a biotech, so she's like, oh yeah, I do my own work for my own research. So I was like, I don't want to do this anymore. I want to be a histotech. And that's how it kind of happened for me. So day to day is a very rewarding job, and we have huge impact. Your doctors cannot diagnose for the patient without those in the clinical lab. So just want to mention that.
No, that's a great point. The impact, 70 to 80% of diagnostic decisions are based off of laboratory testing. So you have, an opportunity to make a huge impact on patients' lives.
And I want to add, so clinical laboratory sciences, it's also called medical laboratory sciences or med tech. When I graduated from that, it was med tech or MLT, which is the 2 years versus the 4-year school. And I believe that Phoenix College has a 2-year program as well. And I encourage you guys, if you are more into doing research or doing just laboratory work and not, going out there to do a patient or see patients or whatnot, try the laboratory. I started with just going into the hospital as a volunteer transporting patients. I had no clue there was a laboratory back then. I didn't know that. And it was like nursing or MD. So once I found out and tried it, I love it and I don't regret anything. And wherever you go, just keep pushing through, because like these two, they just went from different types of the lab or different departments as well. And the same with me, because I was really interested in, I thought in clinical in hematology. I was gonna get a PhD in hematology, but then histology came and then cytology came and I was just like, what? So I went through that. And then I was forced into management and I was like, okay, I'll try that. Did that for about, no, Anthony was it like 15 years now of that. That's my husband. And we work together sometimes. And I liked it. And then now I'm back to just low level cytotech in my cubicle on my microscope, doing digital imaging as well. And I love it. And it's been great. So go, whatever, whatever direction.
Yeah.
I guess I kind of can add on to that a little bit, because I started out in a similar way to how you did, is I started out at Caris Life Sciences, the data entry clerk, it's called sessioning. And then from there, I started asking too many questions and pretty quickly I met Mariana, who just by kind of capitalizing on the opportunities that like the company or the people in the company kind of like pushed me to do, is how I got involved. So coming out of like your bachelor's degree or something like that, you don't necessarily have to move directly into a histotech position. Just kind of getting your foot in the door somewhere and then start capitalizing on those experiences that are offered to you, really pushing for it, advocating for yourself in those experiences is a really powerful way to kind of push yourself in that direction. It doesn't always have to line up immediately in the like exact position that you want to be in. And that's kind of how I ended up here. And I really appreciate the histology experience I had. Even in my current research, I don't think I would be like as strong as researcher as I am. Or like, especially on the microscopy side, really understand like from like a beginning to end kind of like level that I do now. Secondly, too, you guys kind of touched a little bit on the impact of diagnostics on like a patient population. When I was working at Caris, one of the most like significant metrics that like really popped out to me, like it blew my mind, was like the testing that we provided extended the lifespan of a patient like from like 3 to 4 years. It not only extended their lifespan, but it offered like better, like they felt better during that time as well. And then like I was working in a supervisory, or like as a supervisor at the time, so I got to see like the number of cases that get pushed through the lab, which was anywhere between like 200, 300,000 cases a year. And you kind of multiply those two numbers together and you get like over 1 million years, like 1,300, like 1.3 million like years of like life, like good life being added to patients across the nation or the world for like Caris's case. That was really powerful to me. I was like, oh my goodness, as a physician, I don't think like you ever like you could work as many hours as you want, but like contributing to that amount of like, just like loss or like helping human suffering is pretty wonderful. And families, that's time that like families get to spend with their loved ones, things like that. We talked a little bit about kind of like how do you start building this like this relevant laboratory experiences. Do you guys want to talk a little bit more about like how students like during college can start building up this like laboratory experience or establishing connections that can lead to these entry level opportunities?
You guys want to start? Yeah.
Yeah, sure. Yeah, I think as Aiden mentioned, getting your foot in the door into the laboratory is important if it's something that you're interested in. The pre-analytic area, the accessioning department is good. That might be, you might be able to find a part-time role while you're still in school or working on weekends to kind of fill some of the odd hours that the regular 9-to-5ers might not want to fill, but it's great for a student. That's always a good opportunity. And then you kind of have a leg up, as you get your bachelor's degree or get additional experience to move into one of those other departments. Another thing you can do, as for molecular, for instance, at Caris, I know we hire people that just have, biology, chemistry majors without any experience. But we look highly on individuals that, may have worked with a PI and have done like some PCR, some next generation sequencing, are kind of familiar with some of that molecular. So that's something you can do without working in some of those areas while you're still in school as that. And then there's, through ASCP, there's a lot of like mentorship programs that you can go through, get, linked up with somebody in your area and start finding out a little bit more about the profession and kind of build on that. I know in the state of Arizona, they're trying to start a chapter right now through ASCP. So it's kind of the local community coming together and kind of sharing experiences amongst all laboratory professions. So I know that's something that's up and coming. A lot of these networking events and things like that. But yeah, really the accessioning, that's more of a paid experience or, through that PI work in research while you're still in school. So it's kind of two good routes.
I don't think I have much to add. I think he hit all the points. But that's a great example. I'm currently over histo-accessioning at my current lab. And that's something that I would look for in a good candidate, someone that is going to school and currently has some science background. Anatomy is huge for histo-accessioning. It just gives you, it makes you more qualified for the role. I have like PRN roles, like Steve was saying, I need someone that has flexibility. They maybe can come in a few hours here and there between classes, like it's putting yourself out there. Here in Arizona, there's like ASCP is a huge one. Obviously, you get certified through ASCP, but for histology, there's NSH, the National Histology Society. There's one for Arizona, it's called ASH. Anyone can join. They supposed to be doing quarterly meetings. I'm not too sure on that. I'll have to follow up. But it's a good way to network. You can go in and within histology and in the lab in general. Not only do we have a sessioning, but we have lab aides. These are essentially super essential people that we have in the lab that keeps everything moving along. And they have very important roles. But that could be an entry level position that will give you experience for later on. If you want to transition into one of these roles, that will kind of give you some clinical experience.
Yeah, so in LabCorp, in cytology, we have support, right? And sometimes we need people to call the different clinicians to give them abnormal results or specimens that were or cannot be processed. Or sometimes just, hey, your requisition does not have this and that is important. So you can start off on that as well. Volunteering and internship. I believe LabCorp has internship every year. So you can look into that. And what else? They also have in the clinical lab, people that gather the materials for the lab, even the biohazard stuff. You can go into like safety to branch out in the lab as well, not just solely, doing testing. And yeah, so like Department of Health is important for our area, so you can also branch out doing that.
Oh, wonderful. I really like the lab aid positions too, because you kind of get to feel out the different positions inside of the laboratory. Because it's like a lot of these departments, like you don't just have histologists working in the lab, they're working together, like with molecular biologists, with the pathologist assistants. So it's cool to kind of see the different roles around the lab while building that experience. So that's a really cool way to do it. Something with these jobs too that I think a lot of students care about is kind of the outlook of this in the future. Is it resilient to AI? How do the jobs look like currently in the field? Like, are there openings? And then if you can speak a little bit too to the wages, especially starting out.
Sure. Yeah, so the job outlook in kind of all lab professions is really strong. I think some of the statistics that ASCP was looking at, show a very large workforce shortage. It was like by 2025, so we're feeling it right now. There's not a lot of qualified laboratory professionals coming out, so I think that's why a lot of companies and universities are trying to get more innovative and start to offer some of these programs to kind of build through. I think some of the salaries, it really depends. I think Aiden sent out a form of, the salaries by job type. It kind of depends on kind of what your area of specialty is. Some are, hourly, some are salaried positions. It just kind of depends, but they're usually strong wages. Depending, it's probably somewhere between, $25 to $50 an hour, depending on the area of specialty. What's the other question? I felt like I missed.
Oh, yeah, I think it was mainly just kind of like on the job outlook and like, is it resilient against AI,
AI.
especially long term? Like, is this a field that wants to stay strong?
Yeah, and I think it is very resilient against AI. I think AI is starting to augment some of the things more so. If you look at molecular, the vast amount of data that's coming off of a sequencer and using AI to start looking at patterns and looking at kind of longitudinal outcomes from patients and start to find some of those patterns to, see what's more clinically relevant. And then a lot of the, molecular lab especially, there is automation in there, liquid handlers that kind of automate the pipetting activities. So you might use AI in the coding of some of those things. But it's not really like AI is going to take your job. A lot of these, still in, in the medical field, we call ourselves in the medical field, in the lab, and it's more science focused. There really needs to be some oversight by qualified professionals. So we've talked about this quite a bit through ASCP as well, and we don't see that going anywhere with AI coming in. We see it enhancing the profession.
So as a cytotech, we do now have image analysis, pap smears that are on a slide and then going through a slide scanner, and then that scanner will pick different points or different cells for a cytotech to look at specifically, so that we can then generate a report from that. It has not taken away from my role as a cytotech. In fact, it just enhances it. And also we can do more. So, metrics in the lab is important, but it doesn't prevent you from, the AI doesn't prevent you at all from not getting a job future-wise.
Yeah, I think, sorry, I want to say one more thing. Yeah, digital pathology is huge in the AI field. That's something that's really growing very strong. And, I don't know any pathologist that's, I just want to look at slides all day and do the same thing. If they can kind of help automate that in some way and you're starting to get better outcomes, that's going to be something that enhances the patient experience too.
I'm glad you mentioned that because that's huge for histo. I don't think AI is going to replace our jobs anytime soon. We're embracing what AI has to offer. DigiPath is huge. Algorithms are coming out where it's really helping the doctors process more cases accurately, but it's also allowing them to work remotely. So you have better coverage and better care for your patient if I can have someone in Australia 24 hours before me be like, hey, it's my time here, but I need you to read this, and they're able to assess a diagnosis for the patient. So I think like that's the goal, is to have better care for our patients, and using AI towards advancing that type of service. There's been a lot of cool instruments that are coming out in the histo, like embedders that are doing the entire work, but it's not bulletproof. Like I don't think they've been able to fine tune any of these new technologies to replace a human histotech. I've seen pretty cool those machines that cut the slides for you. Essentially, it's like a massive microtome. It was like a massive microwave, and still is not 100% accurate. Like you still have to have the precision a human can provide, and also assessing that what you're processing is correct. So there is pretty cool technology coming out that are just assisting us to be more efficient in the lab, not necessarily replace us. And there is a huge demand for histotechs. Again, like I mentioned, I came from Caris, on my current job. We were hiring people from out of state. There's not enough histotechs. Caris blew up in the last 5 years, and I was part of that transition. And I can tell you, I had to hire about 30 or more histotechs from out of state. And they continue to grow. I know, because I'm friends with them. I continue to grow. I continue to hire. We need more histotechs. We need more PAs. We need more cytotechs. The reality is we need to rely on AI to improve our processes, because there's not enough clinical employees out there that can do the job. So, especially here in Arizona, we are a hot spot for clinical lab sciences and biotechnology. So we're very lucky that we can shift either way. So if you want to be in the clinical lab, you want to do research, I think we are in a really good spot. Dallas is also a good one. Don't know why, but that's where the companies are. So I would say, yeah, it's promising if you were to consider one of those career paths. Yeah.
The big thing too is robotics, right? So in my generation, we had to pipette by hand and on those 96 wells. Are you guys doing that now? Is that, yeah. And labs now don't have to do that. If you have the money,
Right.
you can do that, and it prevents from carpal tunnel, tennis elbow, neck pain, back pain, anything, because I've gone through that. In microtomy, it's rotation, repetitive motions, and robots and the AI and whatnot will help us. So, yeah, create those robots, guys, so that we can get better at our jobs.
In rural hospitals and stuff like that, or rural centers or startup companies will always exist that can't afford that kind of equipment. So there will always be a need for people that can work versatilely with all different tissue types at the bench. So that's a wonderful. Do you tell me the time real quick, just to make sure I'm not over?
443.
4:43. Okay, perfect. Well, I have one last quick question, then we'll open up to Q&A. What you said 4:43?
443.
Okay, so yeah, we have a couple PhD students in the audience. I'm curious if you guys have any insight into where diagnostics or like how that might fit into, or clinical background or background in diagnostics might fit into PhD or research focused career paths, or if there's any industry groups for some of the graduate students that would be looking to go into like a diagnostics career.
I did a little bit of research in the pharmacy department, and we had a couple of PhD people working with like Johnson and Johnson and all that, pharmaceutical companies. So I'm not quite sure, but that is an area that you definitely can get into. Maybe you can start off as RCR, research, I forgot the title thing, but basically the lower level and then just go up. Or if you have like this brilliant idea, propose it to them and go with that flow. Because the PhD that I worked with, he was a pharmacist and he was part adjunct faculty. And so he did hematology and immunology projects for Lilly and all that other pharmaceutical company. And that's how I learned how to do flow cytometry, ELISA, and other PCR and stuff like that, and also necropsy on mice and rats. So you can go through that route. I forgot the question, sorry, I'm like babbling, but that career is definitely also good for or can branch out into clinical, because nowadays there's now a clinical laboratory science PhD program in Texas. And I think that's just gonna get even more popular. And those basically your PhD can transfer into that area, like hematology, immunology, microbiology, blood banking. Are you familiar with blood banking, like donor, blood donor and stuff like that? All parts of clinical, actually.
Kara says, on the clinical lab sciences PhD too, I think University of Jamestown is putting together clinical lab science or like translational research type of PhD. And I know Kara does a good bit of research, don't they?
Yeah, I mean, there's, the clinical research and, really looking at the clinical side of things. Bioinformatics has a lot of PhDs on it, and then as well as, leveraging your technical background to be a medical science liaison. If you have kind of the sales mentality within you, you can kind of go out in the field and, kind of sell more from that technical expertise. Another route that you can go with a PhD, I believe it's the AAB, American Association of Bioanalysts. If you have like a fellowship in there, you can actually become a high complexity lab director, which allows you to lead and have the technical liability for the laboratory. So things like, validations of new tests, and ensuring, you're kind of running from day to day correctly, and kind of hold the licenses for the lab. That's always an option as well. And those are very highly paid careers as well.
Just kind of add to what you were saying, I think it's important to mention that research really impacts clinical, it drives clinical. So even though we're here promoting clinical sciences, R&D is definitely at the heart of everything that we are able to implement from a clinical perspective. So most companies, Caris, LabCorp, all these big companies, they do have an R&D umbrella, if that makes sense. They're always working in the background, just what's next? What else can we implement? How is this even relevant to what we're currently doing? So I think it's important to kind of recognize that they are essential to the growth of a company and clinical sciences as well. So
Perfect. Now, kind of like coming more to the end of the questions. For some of the students in the audience that might be interested in kind of pursuing these kind of careers, do you have any like last bit of advice that you would give them? Kind of starting to step out of like their bachelor's degree, pushing into this field, or things that kind of helped you guys?
Yeah, I think the toolkit you put together is great. Start kind of doing the research through, ASCP and other routes. If you want to pursue this, the universities that may offer this program, medical laboratory science, for instance, it might be a 4-year degree track. It might be a year post-baccalaureate. There's some other programs like that out there, or if you want to pursue more of a master's degree in some of the areas, but just start to get out there, learn about it, make some connections, and start to get some of that experience.
So, if your resume is, still starting, definitely put in the clinical labs that you have, right? So anything from chemistry, biology and all that. So, and then start building it up. So even if you do like 1 hour of volunteer work in a lab here at the university or a hospital, put that in. Put yourself out there as well. Like just don't do what your title or your job description might be. Go out and like, hey, ask another department what they are. I mean, until now, I still ask, like, I still venture out in the lab. I do grossing. I do support even though I don't have to do any of that. It's just something that you get to a level that you think that you're too high to do, but it's never like that. It's always like, hey, this is a team effort, and look at it as a wide thing.
I think for me, something I would do differently if I was in school, I would network a little bit more. I think that's how I learned about histology. Again, when I was in my biotech program, the director required us to do a seminar class. So every week there was someone coming in and showing us their project or whatever they were working on. And pretty cool stuff, stuff that you wouldn't really think about. And then you question it. And then you email them. And then you're like, can I hang out with you for a day? Put yourself out there. I'm all for supporting new techs. Like I had Aiden in my case, and I had a handful of people at Caris, and I will like continue to do that just because you don't know what's out there until you ask or you poke around. I think I would have liked to do more volunteering work as well because it sounds great on paper until you do it. I wanted to be a dentist originally, and then I learned maybe I'm not want to deal with patients that are in pain and maybe not having such a great time. And then I was like, what can I do to help them but not deal with them personally? So that's how I think the lab sciences really caught my attention. Again, I went back to school for business and then I got my master's in business administration just because I knew I was going to take that route long term. But I think, yeah, networking is very important and just putting yourself out there, asking questions, staying curious. I wish I would have done more of that when I started going to school.
Sweet. Yeah, no, definitely you talked a little bit about reaching out to people, advocate yourself when you do so. Like, don't be afraid to reach out to people. Don't be entitled, of course, but like talk about your skill sets, like in your value and things like that. Don't be afraid to, especially like some of like if we have younger bachelor students or like in their bachelor's going through things, don't be afraid to reach out to PIs too about that kind of experience that you want to gain. Don't be afraid in those things. And then also look, you can, if you're looking for experience, you don't always have to look inside the university. I know a lot of we do at ASUs when we're kind of going through class and stuff. We're like, you need to email PI, you need to get experience this way. You can look around at companies and things like that, like email, cold calls, like even LinkedIn, messaging people and things like that. You don't ever know where like an opportunity is going to start. So always recommend kind of looking beyond just those traditional tracks and kind of get pushed to do in university. And you talked a little bit about like not dealing with patients in pain. I originally wanted to be a doctor and pretty quickly inside of the clinical lab sciences or just like working around like patients and things like that. I don't like to see people in pain. Like I definitely feel it with them. And I found it's a lot more sustainable for me to work kind of beyond the bench side with that. And I think you still have that like massive impact on patients. So I think that's always a pretty cool way to look at diagnostics. It's like if you want to help people but not necessarily feel the pain that people are with, it's a really good career for you. So I think we're good to open up for Q&A. Online people, if you put your questions in the chat, once the in-person Q&A is all done, I'll go ahead and read through some of the online ones. Do you guys have any questions? But yeah, if anyone in the audience has a question, feel free just to raise your hand. We could yell it out. Yeah, go ahead.
Thank you so much for the advice. I just wanted to ask, how did you guys end up getting certified? And then what was the process for that? And then how much did it end up costing as well?
For me, I decided to do a histology program through Queen's College. And after you complete that program, it pretty much qualifies you to get certified right away. I didn't take it right away. I was a little lazy, I'm not gonna lie. So I got a job immediately. I was doing my clinical rotations for a small physician-owned lab. They specialize in urology. And they're like, oh, we like you, we trained you already. Stay here. And I'm like, great. And then it wasn't until like 3 years after I gained my experience that I decided to sit down and take the certification. And I think that can be good and bad. The material that I study in the program wasn't super fresh in my head, so I had to refresh on that. But the technical and troubleshooting aspect of it, I was able to answer with no issues. I believe the test was like around $300. It's probably still around $380, but you'll be surprised. A lot of labs will reimburse you for it if you do get certified. And if you are a certified tech, you tend to make more money. As Steve was mentioning, there's some states, California, Nevada, Florida, New York, you have to have state certifications as well or licenses, but they require you to be certified. So here in Arizona, it's not really a requirement yet, but it does make you more competitive.
And I'll also be sending out we haven't sent it out quite yet, but a packet that kind of conglomerates all of the different certification programs that are available, as well as like the cost for the different exams. Yeah, feel free to go ahead.
Yeah. No, I mean, my MLS degree, I did my 4-year as a medical laboratory science, and I took it pretty much right after, and I was hired before I even had it with the assumption I was going to get it with X amount of months. Same with my PA degree. And then the molecular biology, I had an employer pay for, and it was a kind of a growth opportunity for me. So you'll see a lot of that as well.
In each of my, I guess, lab experience from one place to another, I was lucky that they paid for everything. So like when I was in school in Virginia for MLS, there were scholarships for me to pay for like a semester, a class. Also scholarship to get the payment for the ASCP as well. So like, for example, here is the National Histo Society, no, Arizona Arizona Society of Histotechnology. They actually have also scholarships. And actually some of the CARES people got that scholarship. And I think that some of the schools now, like ASU is partnering with LabCorp for a full paid cytology program. And that will include your testing as well for ASCP certification. When I was at the hospital, they paid for me to become a cytotech and paid for my certification as well. And when I was in CARES, I got my master's, ASU master's in biomedical diagnostics, and they paid 85% of that. So, you know, you don't have to spend your money, you know, keep those and work for companies like LabCorp has 7,000 a semester for reimbursement on courses. So get in, even if it's the, you know, nitty-gritty lowest level, because all of that other perks is great.
Do you have any more questions out in the audience?
I just wanted to kind of touch on something that Chris talked about earlier, and ask if there is for students who don't necessarily have an MS degree track. Like if you're already kind of educated and you're like to different like degree, is there room for something like that, even if they have a little bit of background in the school? Is there room for growth?
Yeah, definitely room for growth. There's a lot of companies that'll hire you right out of college with that degree, and then, you know, you'll kind of be at an entry level. You can still work in a high complexity lab, but the prerequisite to take the ASCP exam is to have 1 year in the CLIA lab. And that'll allow you to take the exam, and then you can kind of move up from there. There also might be a route in the kind of the like the field service engineer, the equipment maintenance piece of that, like servicing some of the large liquid handlers and things like that. If that's more your speed, and you can kind of start small and then pick up certifications from different vendors and things like that to be able to grow into your role at a higher level.
I guess from the histo perspective, there's different routes to get certification. So if you come in with a bachelor's degree, unless you have like the credits that they require, and then you're able, like, there's different ways to get in. Like there may be a histo trainee role where we provide you with that 1 year of training and experience. And then it's usually a letter that someone in leadership will sign for you to apply for the certification. So there's different routes that you can definitely take to gain certification, and also, you know, make it a long-term career.
Sweet. This one's an online question, and we already covered a good bit of it, but they're a final semester biology graduate student not planning to pursue any additional schooling. And they have hands-on experience with like molecular biology and microscopy techniques. They're kind of wondering what clinical lab skills or qualifications should they emphasize to be a strong candidate, like during interviewing.
I guess it really depends on the area that they're interested in. But I think like Yvonne was saying, your resume just kind of tell us what you're doing and having those conversations. But I know from the histo perspective, depending on what your lab is doing and what kind of credentials and certifications they have, like their CAP. New York State is very strict in how your employees have to have like certain indications, certain requirements that will kind of dictate. But I know, for example, I had employees that didn't finish their bachelor's, but they had enough science credits to meet the qualifications and requirements. And then we provided them the opportunity to be a trainee for the year. And then after that, they were able to even get certified and be high complexity, to do high complexity testing in the histo area. But I think Steve may have better answer in terms of molecular.
Yeah, I mean, I think in general, just really emphasize the experience that you do have, projects that you've worked on, maybe with the equipment, some of the techniques. Show your commitment, how you can kind of see things through. And I think the other part of it that we don't really talk about is kind of the behavior aspect that I look at very highly. When I'm interviewing people, I'm like, are they going to be a good fit for this team? Are they going to get along well with others? It's not just about all of your experience. Are you trainable, and are you curious and receptive to that training?
When I started, I filled up my resume with the equipment that I used in the clinicals, as well as how long I use them, if it's 3 months or 1 month. And then I also had references from the teachers, right? So even if those teachers those classes that you don't get an A in, but you had good rapport with the TA or the teacher itself, ask them and talk to them some more, and they'll give you a reference if they think that you're a good fit for that.
Yeah, so earlier we were talking about genomics being this sort of Silicon Valley Gold Rush of biotech. And I guess stepping out of lab sciences and sort of like wet lab work, would you say that the demand for dry lab computational technical stuff is like, you say the outlook is comparable, or you think that there's not a future for that? That's kind of like my expertise, and I think it's like niche required dedication.
Yeah, I know. I think there's a huge need for that. I think, as like bioinformatics really takes off, I mean, a lot of these companies, it's kind of their own proprietary system. And I think there's different levels to looking at the bioinformatics individual. Not everyone has to have a PhD. I think there's things you can do with a bachelor's and master's as well in there. And there's definitely a lot of opportunity. It's an area that's growing, and a lot of these biotech companies that are popping up, especially like in Silicon Valley, up in San Francisco Bay Area, Boston, San Diego, kind of the main ones around the US. A lot of them are focused on a certain niche, and it's important to just kind of, you can build something from the ground up and some of those startup environments, and it's not going to necessarily require a PhD. So I would say the outlook is very comparable.
There are specific skills that you would be looking for in your specialty, but for the job to do, assigning someone to position.
Yeah, sure. So for cytotechs, we only take master's degree people at the entry level. So we're a little bit different than like clinical lab or histo. So if you are, for example, in hematology department doing flow cytometry, that also requires BS degree. But you don't have to have the certification for flow cytometry or medical technologist at the entry level. I didn't have that when I first started, but I was enthusiastic enough that they saw potential in me that they went ahead and trained me in that different, lab roles. I don't know if that answered your question.
Yeah, and I think from like the pre-analytical sessioning laboratory assistant standpoint, it's somebody that's eager, that's gonna learn quickly, retain information, and then be curious to learn more. That's going to show that, you know, you have that growth potential. And if you have, you know, a bachelor's in a scientific area, that kind of opens up the door for you in some of the other areas that are more high complexity, you know, in the, you know, the downstream analytical process to be able to grow through there. And as we kind of spoke about before, you know, looking at the companies that kind of offer growth in there that might be able to pay for the education or pay for the certification that you need to get. But definitely the entry level roles, I think it's heavily on like the behavior driven piece. And how you show up to the interview, how you present yourself, and then, you know, when you get that job, how you know, show yourself on the day to day.
Building up to what he said, because he's absolutely correct. I think the entry level roles are usually a good way to just kind of prove yourself, right? With Histo, we have a little bit more flexibility in terms of what the requirements are depending on the role. We have technicians and we have technologists, and that kind of dictates the level of education that you need. Some labs it will also dictate the level of responsibilities that you'll have or the different tasks that you can do. From what I've seen in bigger labs, usually we have a lot of great graduates that come in, they get that entry level role, prove themselves, get the experience, and then they branch out to whatever gets their attention. And that's when the trainee roles come into play for a lot of bigger labs because, okay, you have the qualifications, you meet the requirements, we're just going to take you in, train you for a whole year, and hopefully that will help with certification, you know. So what do I look for when I'm interviewing someone? Someone that's trainable, someone that wants to learn and has high attention to detail. I feel like anything in the clinical lab requires people to have high attention to detail. At that point, you're dealing with patients' lives. One small mistake at a session can carry over, and then you're misdiagnosing someone, and that's just, you know, awful. So, yeah.
I want to add something too. So from my experience, if you don't have anything at all that you can put in your resume, go and like do emergency medical technician first or something like that, or phlebotomy. That's like a 5 month, very low level course to take. And then that with a little bit of experience can then put you into the lab or hospitals and then go from there.
One thing too, I remember interviewing that's like been pretty ubiquitous across like any interview I've ever done is the question of like, what is a mistake or a conflict you had in a workplace and what have you learned for it, or like how have you progressed through it? That's a question that pretty much every employer asks, and we can like definitely tell when you kind of bullshit the question or be like, oh, I'm too much of a perfectionist or something like this. Take those times to really kind of reflect too on areas where you have like made a mistake and then you have like learned something from that and kind of like really think about that question, how you're going to demonstrate to the employer or the person you're interviewing for that you are you're teachable. Because that is something that's really like that matters a lot inside of the laboratory sciences is that when you do make a mistake, like mistakes are going to happen and we're all human, but when you do make a mistake, how do you learn from it? How do you prevent the mistake from happening again? How do you not like kind of take that mistake out on your peers around you? How do you kind of like work inside of a team environment? Those are really big things that I always like focused on during interviews, things like that you guys hopefully might agree with.
Yeah.
Yeah, definitely. Like I asked, give me an example of when you made a mistake or when you called a clinician and they didn't like your answer. What did you do? Stuff like that.
Yeah, and you know, through that, we want to see accountability, like in that question, you know, it's not like, you know, like Aiden said, you can definitely tell when you're kind of faking it in there, but also what we want to see in the lab is, you know, if you make a mistake, you're going to have that difficult conversation, but we want to correct it because it's the patient's lives in your hands. And we want that, you know, best possible outcome. And that's just really ethical, right?
Yeah, own to the mistakes. Don't hide it.
applying, how to, figure it out.
Yeah, I think really through the company website is probably the best. There's just a lot of scams on LinkedIn right now, unfortunately. Some of them are legit, but I really think the best place to apply is the company website that you're looking at. It's a good place to start on LinkedIn, but always I go to the specific page itself.
I agree.
Maybe I'm realist. Whenever y'all were especially early career, whenever y'all were prospecting and looking for those entry level positions and later on your career paths, what was things that you looked for at the company or at the places that y'all were working for? What were things that either personal or something, like knowing that, oh, like this place will support me in my career.
I'll answer that one. So I think my priorities changed throughout the year. I'm not that old, but I will say when I first started, I was eager just to get the experience. So I would have probably taken any job that was willing to show me more and train me more. I was very lucky and I got hired right after my clinical rotations. Within like 3 months, I had an offer that double my salary. Just because I want to help this other lab as a PRN, someone as needed, essentially, I would just go and help. And they're like, we really need someone full time. Are you willing to come here? We want to offer you X, Y, Z. And I'm like, that's great. But career growth was very important to me. So bigger labs tend to offer a little bit more in that sense for career growth. And I think they do want you to do better. Because they want to keep you there long term. So that's something that today I would look for if I was looking for an entry level role. A company that has good benefits and is willing to support me through, tuition reimbursement. Or for example, at Cares, I use that as a great example because we promoted certification. We wanted our techs to get certified. It made us more competitive. It made us look better, but we also facilitated, if you don't know, when you get certified, it's not a take the certification and you're done. You have to renew, you have to take credits. Every 3 years, you have to renew your certification. And something that we facilitated was CEUs for all of our employees once a month, making sure that they were up to date and they were able to just turn around and submit for recertification. So a company that will support you in that sense, I think that's something I would look for. And good benefits.
Yeah, I think that's absolutely right. Really look at the whole picture. If you have 2 offers on the table and one's $1 more an hour, that might not be the whole picture that you're looking at, right? Things like the tuition reimbursement, from your degree that you have student loans on, or for moving your career forward, even like 401k match, stock options, those types of things outside of like the insurance benefits and things like that. Even time off, and what the company's offering in terms of like sick time, PTO, that type of thing, as well. So kind of look at it holistically and don't focus so much on the money. I know it's important coming out with student loans. But think about your long term and what that's gonna sustain you for.
Ditto, basically. The other thing I look for is also the team, right? So yeah, look into or ask them questions like, how many techs are there? How many techs left in the past like 6 months? You're allowed to ask those kind of questions. Any turnaround or fast turnaround, something's happening in that team. And it could start from just tech level, or it could start from the higher up level. So you don't want to, go into a disarrayed department, right? So yeah, think about your questions when you go in. And maybe if you have names of those companies or people working in those companies, yeah, search them as well.
Do we have any more questions? If so, probably last one. Okay, up in the back.
I have a question. I know that ASC offers a BAS and applied medical laboratory science. I was just curious if what you guys think about like the trade-offs between getting a BAS like a specialized medical laboratory science, but that's what I'm interested in, or the traditional like BS route and applying for the that's specialized.
Yeah, so I think, it's specialized, but it's not, right? It's a specialized degree, but I think your opportunities are very broad in that way. For instance, I kind of coming out of California, I was there for the last 13 years before I moved to Arizona. That like CLS generalist license held a lot of weight. You could work in any area of the lab and oversee any area of the lab. So you have a lot of opportunities within the lab field as long as you want to commit to the laboratory field. Good, yeah.
So thank you everyone so much for coming. Feel free to come ask us any, like, you wanna come talk with us for a couple minutes afterwards, I won't be too long. I also am certified as well, if you have any questions about me, I'm a little bit a younger professional, but I'm more involved on like, I'm currently doing research here at ASU, working with the core. We're actually scanning in all the slides right now from LabCorp for the ASU cytology school. So like kind of combining that digital pathology with the cytology stuff, which has been pretty fun. But yeah, thank you all so much for coming, really appreciate it, thank you guys so much for being with us.
Thank you.
Good luck in your future.
Yeah, good luck to everybody.
Go work with me, please.
It's,
I think we all are.
yeah, when you were doing,
Me
I was,
Yeah.
when I was doing the job search last night, because I was putting together kind of a list of like available positions. Histotech, there was like over 70 open positions in Arizona. It was crazy, like the job outlook for, or like just the amount of jobs available for the clinical lab sciences right now.
Roasters too. I'm PA.
They're open to school for it.
Mhm.
That's the
I mean,
first
there's
day
only-
we're very happy, right?
Yeah, I mean, there's only, what, 2,500 PAs in the country certified.
And we feel it.
We
I
go.
don't even have one.
I have a couple questions.
You have
I can't
one?
really quick.
Yeah.
But I'm really interested in clinical lab. It's just like when I saw this, I did what I wanted to, but I'm a sophomore, so the field is very new to me. I was originally pre-med, but that's not kind of how it's doing. Of course, this is where I really like the lab aspect, and obviously you guys talking about like the job aspect there, but to do that, either work in like a hospital setting but I've been doing research as well, so nothing like a clinical research setting, but as a laboratory specialist, like working at a physical lab, that office for many years. Like that, but like I mentioned, ASU does offer like an applied science, both medical laboratory science. I was like, that's what I want to do. I want to be a medical lab scientist. But right now, I'm like in my BS as a medical microbiologist. And it's like
No.
2 years of pre-grad, and we'll transfer over to that course into the graduation BA. But yeah, I'm really scared to do that, because like it's so new, but like you mentioned, the applied. Yeah, I wanted to see like your guys' I think too, like this graduate, you'll get like just really for that. But again, I'm really nervous. I'm starting up on the application for it pretty soon. Start the term in December. They do like blood, so the blood plasma analysis. Any like experience? I know ASU doesn't really provide.
So like,
Except this little 2-year program.
That's a good idea, but keep them branching out.
Are you?
Different areas that you're able to, like, for example, I'm not gonna say I'm limited, but I'm like, I'm just, when you go through that kind of program, my point to different area, I think it just gives you, the upper hand to make it whatever you want it to be.
And if they look okay for it, that would be the best. Yeah, get that done in 4 years, but then I want to 6 years, I think 4 years graduate and then 2 years additional program. Okay, so what I'm hearing is good thing.
I think it's smart.
Yeah, okay.
Yeah, I think-
I want ASU to be more, obviously.
Yeah, and I think it's like rigorous enough. You're gonna find that area of specialty that you like wanna be in. But I think it also like prepares you for graduate coursework and go through it. But yeah, I mean, you get a really broad scope of everything and like the job is pretty much secure.
Right, that's,
Yeah.
job security is
So-
a bit important for me, and I got this fucking certified right away work. I guess like for me, like BAS, you guys are interviewing with that. Okay, because I saw, like, wait, I don't have a BS, that's a little scary, obviously. The BAS is totally.
Yeah, I mean, as long as it makes you eligible for the ASCP exam. Whatever, it's.
Yeah, that's definitely the route.
Yeah.
Well, in a few years.
I just will take mine.
I'm not like a bio or biostatics person, but I understand that a lot of those tools have had a big impact on their work.
Yeah.
So I'm kind of curious, like how that impacts and if there's any like shortcomings you see. That type of computational.
Yeah, absolutely. I mean, really in the molecular space, like all the data that's coming off